when it comes to a crisis, when the stakes are high or the time pressure is on, you need the noise minimal because you have to take action.
Build trust long before you need it. And in that moment, it's not a crisis for me. I've done this hundreds of times, but in that moment, it's a crisis for them. And in the same way, we have to be able to stop and say, okay, here's what I need you to do. Welcome to Science of Leadership, where we explore leadership both practically and scientifically. What makes great leadership, why these things matter, and how we can do them well. Those are the questions we dig into through fascinating conversations with inspiring leaders. I'm Tom Collins, and I'm thrilled to have you join us on this journey to becoming a better leader. Today, we're diving into a leadership skill that becomes absolutely vital when everything is on the line: effective communication during a crisis. In crisis situations, whether medical emergencies, organizational failures, or rapidly unfolding public events, leaders must communicate with clarity, steadiness, and precision. To help us explore this, I'm honored to welcome Dr. Sofie Morgan, an emergency medicine physician and the Associate Chief Medical Officer at the University of Arkansas for Medical Sciences. She's a graduate of Vanderbilt School of Medicine, where she also completed an MBA. As an ER physician and healthcare leader, Dr. Morgan has spent her career on the front lines of crisis situations, both clinical and organizational, and understands deeply what it takes to lead effectively in life and death situations. Sofie, thank you for joining me on the Science of Leadership.
Thanks for having me, Tom. Crisis communication is absolutely key. It's a real test of organizations and teams, and I'm excited to dig into that topic a little more with you.
Well, with that in mind, let's just start with the foundation. I like to just lay out definitions on the show and once we get going. So, when you think about effective communication during a crisis, what comes to mind? How do you define it?
Well, for one, effective crisis communication is clear, it is calm, and it is succinct. Emotions tend to get high. There's a lot of chaos, there's a lot of noise, and effective crisis communication cuts through that and helps the team have a sense of direction. It sort of regulates the emotional temperature of the room and helps people move from a state of fear to one of action, next steps moving forward.
That's really valuable information, concise, clear, cuts through the noise. As I think about medicine, academic medicine, we're both in academic medicine. It seems like so many times when we're talking, we buttress what we're saying with so many things, right? To make our whatever we're saying airtight, and we hem and haw and kind of dance around things sometimes. And I think that adds ambiguity. It muddies the water. We're trying to be eloquent, but then we sacrifice clarity, we sacrifice brevity and direction. As I think about crisis communication, it really is this ability to distill what's essential, eliminate all those things that aren't, and then move people toward the right action at the right moment. So, yeah, I think that's vitally important. I'm curious what your thoughts are just on what I was saying about in academic medicine. Maybe it's that way in other places, but I think in academic medicine, we spend so much time qualifying.
Yes, absolutely. I think we are trained to weigh things and pros and cons and, well, there's this piece of evidence, but there's that piece of evidence. And we do have those type of conversations. And when there is time, when you're not in the midst of a crisis, those are great conversations to happen. And a lot of times things are not black and white and they are gray. So again, appropriate in the right setting. But when it comes to a crisis, when the stakes are high or the time pressure is on, you can really get lost in that. And it's not the time and place to discuss that. Now, there is sometimes discussion. Sometimes you need to, get pieces of critical information, but that's different than debating and discussing. It's not the time and place for that. It does lead to ambiguity. All of a sudden, people don't know. Well, what do you want me to do? What am I supposed to be doing? What's next? And being clear and being directive and eliminating that part of the conversation really does help move you through. And you can have that conversation later. It's just not in the moment.
Sure. Well, I'm curious, can you share a story from your experience and career in the emergency, setting of what it really looks like to communicate effectively in the middle of a crisis?
One situation that comes to mind, tough situation, sort of the nightmare situation working in the emergency department. I got notification working one shift that there had been a mass shooting in the area. And the first thing that happens is your heart rate speeds up. But that's when the experience really kicks in because you can't just sit there. In that fight or flight response, deer in headlights, you've got to get moving. So my first step in that scenario was to go chat with the charge nurse. The charge nurse really has the sense of the flow of the department, what's happening, and she was the one who had spoken with EMS and police. And the first thing I wanted to know in that scenario, what do we know? What do we not know? So in this situation, we knew that 10 people had been shot, but for example, we didn't know how many had made it, how many would be coming to our hospital. So a lot of uncertainty. So once I got that initial information and she and I had conferred, my next step was a cascade of really targeted communication. So one, making sure our hospital leadership was aware. Two, mobilizing people. You know you need extra sets of hands. You don't know how many, you don't know where you need them at just yet, but making sure we've got people ready to go. Making sure we're clearing space. So clearing off the X-ray and CT scanner. If there are patients who are stable, moving them out of the area, and then pulling the team together. And that was really the next step. And we were lucky. We had about 10 minutes of notification. So we had time to do this. You don't always have that. So getting the team together and really setting that calm tone, the orderliness. And there were a couple of key pieces that I wanted to make sure I communicated at that point. The first was, again, the same thing I had learned from the charge nurse and learned so far. What do we know and what do we not know? The second was making sure everybody had a role assigned and knew what they're supposed to be doing. And then the last thing was just some really key, quick if then scenarios. So it's hard to make decisions in the moment. There's a lot of information coming at you, and it just simplifies a few things. And some things, not everything's predictable, but there are a couple of things you know might happen. And so, we did that. That was all prep. At that point, we had patients starting to roll in. That's where we're really shifting to that like calm, clear, directive language, making sure we're doing closed loop communication. So, for example, if I ask you to administer a medicine, asking you to tell me back when you've given it, things like that. Another thing in that scenario, we've asked for extra people to come. It's a very, again, exciting is not the right word, but emotionally active kind of thing. So it gets loud, and there are a lot of
Mhm.
extra hands and a lot of extra people. So making sure we only had essential voices. And if there are extra people, extra hands, assigning them something else that could be helpful, but not in that moment, not in those treatment spaces. Really, at the end of the day, is trying to create order out of the chaos
Mhm.
of the moment. The team came together. We had one patient that we lost due to injuries that were too severe, but the rest of the patients, we were able to save their lives. And a big part of that is also in the moment prioritization and that triaging, which we're trained,
Mhm.
it's a combination of training and experience, but where are you going to deploy your resources? Who is free and ready to help? Who's tied up in something else? When, and this is a hard one, but when something is beyond your capabilities and you really need to shift your energy somewhere else or to somebody else. And so as things calm down, as patients were stabilized, you really move to this kind of final phase of a debrief. And that is a moment to one, just process what happened because it is a lot, but also to reflect on what went well, what needs to be reinforced for next time, or what really needs to be tightened up. And that is a standard practice. And I mean, it's huge. It's a key piece of it, right? Because if you don't walk out of that situation having learned something, it's going to be that much harder the next go round.
Mhm. That's a powerful example, clearly, of really crisis, life and death sort of scenario. And there's so many things there that were kind of running through my mind, having been in those scenarios myself. And the thing that I think is important for our listeners, there are many things, but one thing is command and control leadership is so often spoken of negatively currently. And in almost every situation, I would say that's true, that command and control is not a good leadership approach, except when it's a real crisis. When it's a real crisis, you need to be able to say, "Hey, I need you to do this thing," and not have somebody debating or whatever. There's no time for that.
Mhm.
I think that what people often miss, this is true in people that don't understand the military or other situations, is that it's all of that relationship building long before that crisis moment, so that people know you take their inputs with value. You value them as a team member. You're there to help them, elevate their performance and so forth. And there's trust and there's relationships. So that in that moment, when you say, I need you to do X, they know this person, I can trust them. I believe in them. They wouldn't ask me to do this unless it was really important. And then they can move forward doing that. And so I think crisis communication, effective crisis communication is built on that. Does it look like command and control? It does, because a lot of times it is, but it's built on so much more that preceded that day when you got that
Mhm.
call. We've had a mass casualty.
Yeah. Yeah, it's both things. So in the moment, you are giving instruction to people, and you need to give instruction to people, and they need instruction. If everybody was just doing what they thought was best, there would be no coordinated effort, and it has to be coordinated. And so you are giving instruction, and that instruction needs to be clear. Now that's different than being authoritarian and saying, "Hey, there's no room for anybody to give me information. Like I'm not receptive at all." No, absolutely, people need to be able to stop the line, or if there's some key piece of feedback or information, you want them to tell you that. You don't want things hidden or unsaid or assumptions. It's about clarity, not just in you giving the instruction, but in whatever feedback or information you get back. And just what you said, that foundation of trust that's built before that moment, that's everything, right? And in a way, it's a luxury because most of the time, these are your colleagues, you've worked with them before. Every now and then, maybe you're in a situation where they're not. But when you are with your team, your colleagues, folks who know you, that prior experience is everything because they know she's listening to me when I'm, in a regular scenario when she's not under stress. I know she's listening to me now. I know she's receptive to me now. That is that trust and that psychological safety that actually makes it that much better, right? Because you've got one scenario, okay, yes, I'm commanding, but I'm completely not receptive to any information, or people assume that. And that is is a recipe for real disaster on top of whatever
Mhm.
disaster you're dealing with. And then this other scenario where it's crystal clear. Everything you're saying is crystal clear, and your team knows you, they trust you, and they're going to be crystal clear with you. And I think you used a word earlier like distill, and it's really just that. And that relationship ahead of time makes all the difference in the moment.
Let me pause here for a second and remind our listeners that my book, The 4 Stars of Leadership, is now available on Amazon, Barnes & Noble, and essentially all online outlets. It's getting rave reviews, and I'm certain you will find it not only informative, but also inspiring. So I hope you'll order your copy today. Now let's get back to this interesting conversation. You bring up something that is a great point, wanted to touch on, then get back to this idea about trust because it's so
Mhm.
important. The ability to have feedback in those moments. So for those who aren't in medicine, when somebody has a cardiac arrest in the hospital and we have these procedures that we do, and so life support and resuscitation and all this sort of thing, this idea of the feedback loop where, hey, give, 1 milligram of epinephrine, et cetera, some medication to try to help somebody. The person who is going to actually administer the medication will say that back, sort of feedback. And I can say that and I'm sure this happened to you, there have been times in my career when I've seen or had somebody say, hold on, you said X. Did you actually mean that dose? Because that dose is 10 times higher or 10 times lower, or
Mhm.
whichever it may be. Thank you for feeding back, right? Like that's a significant part of this scenario. That's not debate. That's not saying, is this the right thing to do? It's just clarifying, the communication. So I think that's so important. Now getting back to this point about trust, I mean, you know, I think again, it's built up over all these interactions that precede those moments. And so in my research, in my study of 4-star generals and admirals, I've seen that trust is built on the same 4 things that make up great leadership. So that's character. Do people believe you are honest and are aligned with the mission? Competence. Do people believe that you know what you're doing? In that crisis in the ER, if they don't think you know what you're doing, then they're not going to
Mhm.
follow, right? Caring. Do you genuinely have their best interest at heart? And then communication, which is what we're talking about in this crisis. Do people understand the messages you're trying to convey? And do you listen? This gets to the point that I was just making, and understand the messages they're trying to convey. So those 4, character, competence, caring, communication, are the foundation for leadership, particularly leadership during crises.
Each of those things hits the nail on the head. They had to believe in you, and they have to believe that you believe in them. And I mean, those 2 things, and I think you also use the phrase having their best interest at heart, and particularly in the case of medicine, also the patient's best interest at heart. I mean, that creates that layer of safety and trust that you're just in it together. You're going to do your best, try your hardest, figure it out, and will it be perfect? Absolutely not. Nothing ever is. But you're doing it together as a team and not just Tom's doing his thing over here, Sophie's doing her thing over here. We just happen to be in the same room. I mean, that's the difference between those 2 scenarios.
Yeah. Well, as you think about this idea of communication in crisis and so forth, why is it so important? I mean, we've been hitting on this a little bit, but just to lay it out there for folks that are listening, why is it so important to have effective communication in a
Yeah.
crisis scenario?
So I told you what was my first reaction when I hear this. My heartbeat speeds up. Your body is literally going into this stressed fight or flight kind of mode. And, while that's effective if there's a bear chasing you, it's not that effective when you're trying to do complex medical care or complex leadership decisions. And what often happens in these scenarios and with teams is there's like an emotional contagion. Everybody's heartbeat is going up. Everybody's fear level is rising. The stakes are high. People know things could go wrong. People are self conscious. Am I going to do it right? And there's a lot of uncertainty, like what is going to come in the door we don't even know. And so when that happens, people's vision narrows for better or for worse. And in this case, sometimes it's for worse because it's like a cognitive overload and you can get stuck in analysis paralysis, which, to your point earlier about that crystal clear directive communication. If you get stuck in analysis, it's ineffective. If you're overwhelmed, you can't take action, at least not effective action. People also start taking shortcuts when there's a lot of pressure because you feel like you're in a rush, and maybe you are. Maybe there is a time pressure, but it's just a setup for mistakes, a setup for actually inaction. And if you don't come together as a team, and the communication is a key critical part of that in a crisis, I mean, the whole thing is at best all friction and doesn't go smoothly. And at worst, significant errors can get made.
Yeah. Do you have an example that you can think of from your career where that communication in a specific moment was critical in a real sense that made the difference in life and
Mhm.
death?
Sometimes it's information from people in the room that otherwise maybe you're thinking to sideline. And this is where that kind of openness and receptiveness to information comes in. So, one of the key things, and we've talked about trauma resuscitation, so I'm going to stick with that kind of example. One of the key things is that we pause once we make sure the first couple of initial things like the patient's airway and breathing are okay and they're safe in that perspective. The next thing we do is we make sure to speak with EMS. What was happening on the scene? That information can really absolutely change what comes next. So, for example, well, this person was ejected from the car. Well, we didn't even know that, right? Or actually, this person's pregnant. I mean, there are so many like little tiny pieces of information that in the moment can get glossed over, or you're rushing. Again, you're narrowed. Oh, this person needs XYZ procedure or treatment, and you're not listening at the same time that you're doing. It can really derail you and waste time. And the stakes are high, so there's not really a whole lot of time in these type of scenarios.
As you were saying those things, I was thinking about, in a sense, crisis. And you were saying, we have fight or flight, or, freeze, and sort of mental thinking. And sometimes a crisis is happening, and I think, and so I'm just riffing here, but sometimes a crisis is happening for somebody in a moment.
Hmm.
And we need, as leaders, it may not be a real crisis in a true sense, but it may be a crisis for that person in the moment. And we have to be able to identify that moment and speak into that moment.
Hmm.
So the thing that I was thinking about, thinking way back in training, doing central lines. So for listeners who are not in medicine, there are times when patients need a significant amount of medications. They need access to be able to administer those, draw blood, do other things. And so you have to put in these larger IVs, if you want to think of them that way, but they're located closer to the heart so that you can administer things immediately and so forth. And so it's a procedure to do this. And it's a not uncomplicated procedure, and many steps to it and so forth. And at the time that I was doing a lot of them in training, and I've trained a lot of people. I don't know how many people I've trained in putting in central lines in my day, but a lot. And at that time, we didn't use an ultrasound machine to identify where vessels were. We just knew anatomically where they were and so forth. And so a subclavian, so the clavicle, right below the clavicle, and the clavicle is the collarbone. Right below the clavicle, there's a big artery and there's a big vein. And so you can put a needle underneath the clavicle and you can enter this vein and you can put this IV, this large IV into it. And if you screw that up just a little bit, you poke a hole in the lung and you get a collapsed lung, or you can poke a hole through the artery and cause all this bleeding, all this. Anyway, and so in that scenario, imagine I've done hundreds of these, and here's this new trainee who is let's say a first year resident. They're right out of their medical school. They've never done this before. And I'm saying, okay, we're going to do this, what in theory could be life-threatening procedure because people have died from it. We're going to do this life-threatening procedure, and you're going to be the person doing it. And I'm just going to stand here and tell you kind of how to do it. And they freeze. And in that moment, it's not a crisis for me. I've done this hundreds of times.
Hmm.
Um, but in that moment, it's a crisis for them. And in the same way, we have to be able to stop and say, okay, here's what I need you to do. Right. So So, in a sense, crisis almost isn't even necessarily everything's on fire or whatever, but it's where is that person? So, I think my point is being attuned to the people that we're trying to lead and where they are and understanding that sometimes they may be in a crisis and unless we're paying attention, we won't even know it.
Yeah, absolutely. There's a certain look that often you can identify, and it's kind of this glassy-eyed look, and it is that freeze. You can tell this person is, in essence, afraid to do anything in this moment. And yes, there is, especially if you are a more experienced or more senior leader, someone who's done this before. There's some validation that, yeah, it's normal. This is your first time doing it. It's normal if you are feeling a little nervous about it. But then again, the chaos that's in their head trying to pull them out of that towards action. What are the steps? And anytime you look at something as some huge, big thing, or, sometimes it's more than just a perception. Sometimes maybe this is a patient having the worst day of their life. Something horrible's happened to them. It's not happening to you. You're okay, but you're trying to help them. When you look at that whole big picture, everything is always scarier, but when you're able to break it down into those clear,
Yeah,
simple
right.
steps, uh, it seems doable. Maybe you just gave somebody a cancer diagnosis and, they're thinking, "Oh my gosh, am I gonna be dead in a month? What's gonna happen to my kids?" And those things are very important and it's normal to think them, but like, let's back up to the next step. What is next? How can we get you an appointment you need? What effect is this having on you now? And it's breaking, that huge steep mountain ahead into small steps for somebody who may be having, as you said, that kind of individual crisis moment, and you're the leader trying to help guide them through it.
Yeah. Well, let's take a quick science break here because I think the research really perfectly reinforces what we're discussing. So, first, communication clarity, which we've been hammering on, we've been clear about, if you will, is one of the strongest predictors of successful crisis outcomes. So, there was a study in 2020 in JAMA, that's the Journal of American Medical Association Network Open, examining medical emergency teams that found teams with clear directive communication reduced time to intervention by over 30%, which dramatically improved clinical outcomes. So that's obviously that's a strong piece of
Mhm.
information. Second, social psychology tells us that in acute stress situations, and this is what we've just been hitting on, that acute stress is different for different people. People experience cognitive narrowing, which you were saying earlier, vision narrows. Research by Leach and Griffiths shows that under stress, individuals seek authoritative cues. So they actually look for someone who is decisive, calm, and directive. And that's why what we would refer to as command presence and directive communication matters in crisis. Third, studies on trust, particularly work by Mayer, Davis, and Sherman, show that trust in leadership reduces reaction time because followers are less likely to question motives or competence during those urgent situations. So, together, the science really reinforces clarity matters, command presence and directiveness matter, pre established trust matters more than anything.
Yeah, I love your approach and pulling the science. What does it say? Because sometimes, there's surprises, but sometimes it reinforces what an experienced leader knows or, has been through or has seen. And those pieces, you are trying to get people out of their hesitant state. You're trying to get them to, yes, be focused, but also take in a lot of information and a lot of things happening. And through that process, trust you. And by necessity, and you had hit on this earlier, you're going to have to be using fewer words. You're going to have to be more directive. So that foundation of trust is key to have people follow your lead.
Well, Sophie, let's make this practical for our listeners. For leaders who want to be more effective communicators during crisis, what are some concrete steps that you would recommend for them?
Well, the first I'd say is a mini pause, taking 2 or 3 seconds. I said that heart rate starts going the minute you hear something has happened. And even a simple deep breath to help you bring all those physical signals happening down so that you can hear your thinking a little bit more. And then using your calm to lead other people's calm, to bring people into that space of orderliness, calmness. And it's like contagious, emotions are. And so if you as the leader step forward like that, people pick up on it. And I would also say narrating as much as you can, right? And this is a hard one because we said we're not trying to use too many words, but also you need to make your thinking clear. You need to be transparent about what you know and what you don't know. Nothing breeds confusion and fear like the unknown and silence. People start filling in, information gaps and
Yeah,
usually making up the worst version
right.
of the situation that's possible. So you have to own the information, if that makes sense. We talked about that prep. and the debrief, and I think those are key pieces not to forget. Now, you can't predict what's gonna happen, and that's the nature of these things, but you can prepare, and you can at least hit some of the, common low bar things that are most likely to happen, in a scenario, and then the debrief. You will no matter what you think, you'll get through it. The crisis will eventually pass, and learning from it because, as you know, history repeats itself if you don't take the time to, stop and learn.
Yeah. Well, those are great. The debrief that you're describing is consistent with what the after action report that a lot
Mhm.
of organizations use now that actually was derived from the military. And it's really going over what are the learning opportunities that we have in this scenario. I was struck by this idea of narrating that you were talking about. Like that is valuable, as you say, being concise, but allowing people to know what you're thinking, where you are, where you think things are heading, so that they can entrain onto that same path
Mhm.
that you're thinking about. So those are valuable. Thanks for sharing those.
Absolutely.
As I thought about this, leading up to the episode and thinking about things that we would talk about and the sort of things that I would share as practices, I came up with 5 that I think that leaders could begin using today. And so one we hit on was build trust long before you need it. I think,
Mhm.
communicating consistently, being honest. Again, this is ahead of time. Demonstrating competence, showing genuinely that you care. Um, Crisis communication is built on that pre-existing credibility, and so do that beforehand. The number 2, establish and rehearse crisis communication protocols. We do this in medicine all the time.
Mhm.
Scripts, roles, channels, command structures, all that is laid out. What's going to be happening? Who's going to be doing what, when, where, how, so forth. I think that's vital. Number 3, default to clarity and brevity. Short sentences, clear directives, no ambiguity. Number 4, embrace your role. And this can be hard for some folks. Embrace your role as the decision maker. In a crisis, leaders must be comfortable being directive. This is the right time for command and control. Again, you got to be open to feedback when you say something that's off target or so forth, but you got to be comfortable saying, this is the time that I really have to help our team move toward this target in very short order. Number 5, close the loop. And you've been saying this, said it repeatedly. Ensure people heard and understood the message. Verification is not optional in crisis settings. Any thoughts on those?
Yeah, I mean, it's not easy, right? If this were easy, we wouldn't even be having this conversation, right?
Right,
We'd all be
exactly.
experts at
We'll be
it.
on
It's
having this
not easy.
podcast.
It does take experience, but the need for um, really that just open line of communication that's clear. All the noise and signals out of it. I'm picturing this analogy, and I'm not a sound expert at all, but I'm picturing like a little sound bar that has all the lines moving. I mean, you need the noise minimal because you have to take action. And as that leader, you have to move people to the next step. Is it the right step? Is it the wrong step? Is something crazy going to happen next? Who knows? Nonetheless, you have to move forward and take action. And that's that role of the leader. And I think the points you've said are great tips to try to get to that point.
Well, before we wrap up, I have one more question for you. What is one leadership lesson that has had a tremendous impact on your life and career?
So, what I would say, and it falls right in line with our conversation, is that communication is not a soft skill. And coming from the world of medicine, you hear all the time, like, "Oh, there's like the real medicine, and then there's the art of medicine." And like, I use the analogy of a cake sometimes. Like, people act like the communication is just the icing on the cake, but the actual like medicines and procedures and treatments you're doing are the cake itself. But that's not true. That communication is a core piece of that cake, right? We talked today about in crisis and that it's make or break. I mean, it can really make or break an organization, a medical team, whatever, your response to a crisis. And even in other types of scenarios, I mean, you want your team bought into a certain vision or certain plan. That takes communication. The example you gave, you're fine, but somebody on your team is having an issue and they're in their own kind of personal crisis. You've got to have the words and the communication and that kind of space between leader and team that's filled with words and tone and body language. So often think of it as secondary or, as I said, like this soft skill, and it's not. It's an absolutely critical core skill in leadership.
Yeah, great leadership lesson to share. I mean, again, it's one of the 4 C's that came out of my work. The last C in the book, communication, and that's because it's so vital, and it's actually really not that easy. It's easy to screw up, and I think that we would all do well to spend more time thinking about how we communicate, thinking about actually our receivers, the people that we're actually trying to communicate with. How are they hearing what we're trying to transmit and so forth? So great lesson. Thanks for sharing that. Sofie, this has been a fantastic conversation. Thank you for sharing your expertise, your stories, and your wisdom about leading through crisis. And thank you for joining me on the Science of Leadership.
It's been a pleasure. Thank you, Tom.
Thank you for joining us on this episode of the Science of Leadership. We hope today's discussion has inspired you and given you valuable insights to help you become a better leader. Remember, leadership is about helping those we lead do great things. It's a journey of continual growth and learning. When we embrace that journey with curiosity, courage, and humility, we can confront challenges, overcome barriers, and foster environments where everyone can succeed. If you enjoyed today's episode, be sure to follow or subscribe, leave a comment, and share it with others who are passionate about leadership. Until next week, keep leading with character, competence, caring, and communication. This is Tom Collins. Let's keep growing.